The heart has an amazing electrical system that keeps it beating in a rhythm, but the rhythm can be disrupted in some people and go too slow or too fast. Tachycardia is when your heart rate goes over 100 beats per minute. Tachycardia has several causes. To understand how it happens, it helps to know how our heart works. Your heart has 4 chambers, 2 on the top, called the atria, and 2 on the bottom called the ventricles. These chambers work together to pump blood throughout our body. The right atrium and ventricle pump blood to your lungs. The left atrium and ventricle pump blood to the rest of your body. Electrical signals travel through your heart, causing it to pump in a regular rhythm of about 60 to 100 beats per minute. These signals normally start in your right atrium. Following a set pathway, abnormal heart rhythms called arrhythmias occur if the signals are fast or too slow. Arrhythmias can also occur if the signal starts in unusual spots or follows unusual paths, or if the pathway has been damaged. Supraventricular tachycardia or SVT is a rapid rhythm that starts in your atria or between your atria and ventricles. There are 2 common types of tachycardia. An atrial tachycardia is a spot in your electrical system that fires faster than the regular signal. A paroxysmal supraventricular tachycardia, or PSVT, is the second type of electrical short circuit. With a PSVT, the electricity goes down one pathway and loops around and up another, faster than the normal signal. Now, let's have a look at the ECG features of supraventricular tachycardia. Supraventricular tachycardias are usually narrow complex tachycardias with a QRS interval of 100 milliseconds or less on an electrocardiogram. On surface ECG, the P waves are usually seen before every QRS complex and have a different axis than a sinus P wave. At high atrial rates, the P waves may be embedded in the descending limb of the T wave or completely obscured by the T waves. If the patient is hemodynamically and clinically stable, the most important diagnostic step is to obtain a 12-lead ECG. Once the ECG is obtained, the 4-step approach should be applied to diagnose the kind of SVT. First, determine whether the QRS complex is narrow, that is less than 120 milliseconds, or wide, or more than 120 milliseconds. A narrow complex confirms the supraventricular origin of the arrhythmia, whereas a wide complex may represent ventricular tachycardia or SVT with aberrancy. Second, if the QRS complex is narrow, assess whether the rhythm is regular or irregular. An irregular rhythm generally excludes AVNRT and AVRT, and is more in favor of atrial fibrillation, or atrial flutter or tachycardia with variable conduction through the AV node. A narrow complex tachycardia with a regular rhythm is likely to be sinus tachycardia, AVRT, AVNRT, atrial flutter, or atrial tachycardia. Third, to diagnose the mechanism behind the narrow complex tachycardia, look closely for any sign of atrial activity or P waves. If a P wave is seen, the final step is to assess its place in the cardiac cycle by comparing the RP and PR intervals. If the RP interval is shorter than the PR interval, that is, the P wave is seen immediately after the QRS complex, it is likely a retrograde P wave, and the most likely diagnosis is AVNRT or AVRT. If the RP interval is longer than the PR interval, that the P wave is seen before the QRS complex, the most likely diagnosis is sinus tachycardia or atrial tachycardia. As we have seen, these are the ECG features of supraventricular tachycardia along with the types of SVT. In the next video, we will discuss different types of SVT along with their differential diagnosis and treatment options available. Thanks for watching. Please subscribe and support us to learn more. Thank you.